Hi everyone, my name is Deepa. For this community and population health assignment, our group focus on vulnerable population group, which is non-English speaking immigrant aged 50 to 80 years. This group is considered vulnerable because they often face multiple challenges such as language barriers, social isolation, and difficult accessing healthcare service. These challenges can affect their overall health and well-being. In this collaborative group assignment, we work together to explore the need, risk, and possible support strategy for this population. Our group members are Leo, Christine, Omika, Ruchika, Grisma, and myself, Deepa. Select this community because non-English speaking older immigrants face several challenges. They often experience language barrier which make communication and understanding healthcare difficult. They may also have limited access to healthcare service and low awareness of Canadian healthcare system. Many experience social isolation and loneliness along with high risk of chronic illness. Transportation and income barrier can prevent them from getting healthcare they need. Now let's talk about community parameters. This community is based in Toronto, which has a larger immigrant population. It includes adults aged 50 to 80 years who have limited ability to speak English. They come from different cultural backgrounds, including refugee, permanent residents, and sponsor parents or grandparents. Many live in apartments, subsidized housing, or with their family.
Now I will be talk about community statistic. Toronto is a very diverse, but many senior immigrants faces challenges like language barriers, which affect their access to the healthcare and lead to the incidence of diabetes, hypertension, and heart disease among the older immigrants. Risk of depression is also the another cause because of the social isolation, and this shows that they need the better support and culturally sensitive care. For this project, we will use different community assessment method to understand the population needs. We will start with need assessment to identify key health issues and service gaps. Then we will use surveys and questionnaires to collect information from a larger group. We will also conduct the interviews and focus groups to understand people's experience and shared concerns. In addition, we will review the government health data and map community services to identify available resources and gaps. Together, these methods will give us a clear understanding of community needs. The purpose of community assessment is to understand the health need of population. It helps identify the unmet needs and the barriers to care such as language, cost and access. It also supports program planning and helps improve the existing services. Overall, it ensures the healthcare is more effective, accessible and patient-centered.
Hello, my name is Krishma and now I am going to talk about the sources of information. So we rely on organizations like Public Health Agency of Canada, Canadian Public Health Association and Registered Nurses Association of Ontario. Additionally, community health centers and settlement agencies provide local support and resources for newcomers. Next slide is about community challenges. Many communities face barriers such as language difficulties, limited access to healthcare services, social isolation, and cultural differences. Other important challenges include low income, transportation difficulties, and limited knowledge about available health resources. Next slide talks about strengths and challenges. Despite these issues, communities have strong cultural connection, supportive families, and active community organizations. However, challenges like language barriers, lack of awareness about services, and transportation problem still persists. Next slide is about capacity building strategies. So, to address these issues, we can implement interpretation services and provide health education in their own native languages. Outreach programs at the community level can improve awareness, and training nurses in cultural competence can ensure more inclusive and effective care.
This slide shows important health organization in Canada. Community Health Center provides basic care and support. Settlement agencies help newcomers adjust to life in Canada. Multicultural organizations promote inclusive and culturally sensitive care. Public Health Unit and Public Health Ontario focus on disease prevention and health promotion. The Canadian Mental Health Association supports mental health services. Senior Center help older adults stay active, and the Public Health Agency of Canada works to protect health at a national level. This slide highlights some key community weaknesses that affect health outcomes. Language barrier and cultural differences can make it difficult for people to access and understand care. Social isolation and low income also limit support and resources. Transportation issue and long wait time create further challenges in accessing services. Additionally, a poor understanding of the healthcare system and lack of culturally appropriate care can reduce the quality of care people receive. Addressing this barrier is important to improve overall community health. This slide focuses on capacity building strategies to improve community health. Providing interpretation services and health education in different languages help overcome communication barriers. Community outreach and partnership with settlement agencies increase awareness and access to services. Transportation support program make healthcare more reachable. Senior social group help reduce isolation, while cultural competency training ensures provider delivers respectful and appropriate care. Overall, these strategies strengthen the healthcare system and make services more inclusive and accessible for everyone.
Addressing the needs of this population requires collaboration among multiple stakeholders and gatekeepers. Stakeholders are individuals or groups with an interest in or affected by healthcare outcomes. In this case, stakeholders include older immigrants, their families, and healthcare providers such as nurses, doctors, and social workers who are directly involved in care. Gatekeepers, on the other hand, are individuals or organizations that control access to health services and resources. These include community organizations, settlement agencies, healthcare administrators, and government health agencies that determine how services are delivered and accessed. Older immigrants and their families are central in decision making, especially when language barriers exist. Healthcare professionals play an important role in delivering culturally competent care. Community organizations and settlement agencies help bridge language and cultural gaps by providing interpretation services and support programs. Government policymakers also contribute by creating policies that improve access to health care. Additionally, community and religious leaders can influence trust and engagement with healthcare services. Together, stakeholders and gatekeepers help reduce barriers and improve health outcomes. Evaluation techniques such as surveys, interviews, and community assessments are important in understanding the needs of this population. These methods provide valuable community information, help identify health needs and service gaps, and support effective program planning. They also allow community members to be involved in decision making. However, there are several limitations. Language barriers can make it difficult to conduct surveys and interviews accurately. Isolated seniors may also be difficult to reach, and the process can be time consuming. Additionally, some data collected may not be fully represent the population or may become outdated. Therefore, culturally appropriate and inclusive methods are essential for accurate evaluation. Within this vulnerable population, certain groups are even more at risk of being unheard. These includes elderly individuals who do not speak English, isolated older adults, women who stay at home, refugees, individuals with low income, and those experiencing mental health challenges. These groups often faced multiple overlapping barriers such as financial limitations, social isolation, and stigma. As a result, their healthcare needs may not be fully recognized or addressed. As nurses, it is our responsibility to advocate for these individuals. ensure culturally safe care, and actively include their voices in healthcare planning and decision making.
On this slide, I will be talking about advocacy and ethical considerations. This includes equity in healthcare access, cultural sensitivity, informed consent, and confidentiality. Equity in healthcare access, such as fair access based on patient needs, cultural sensitivity through respecting diverse beliefs and values, informed consent means patient is fully informed about the risks, benefits, and the options. Lastly, confidentiality tackles about protecting patient information by adhering to privacy laws. By having a good team dynamics, we learn the significance of cultural competence, what is a nursing role in the community evaluation, how vital it is, teamwork and collaboration in our works, and lastly, we learn also the role of social determinants of health in immigrants. Our team conclude that non-English speaking immigrants aged 50 to 80 in Toronto face significant challenges such as language barriers and difficulty accessing healthcare, making them a vulnerable population. These needs can be identified through community assessment. Nurses play an important role in improving health outcomes by advocating for and supporting this population. The references that we use in our study